All right, today I want to talk to you a little bit about plantar fasciitis, something I have dealt with in the past and have found different ways to treat it. What plantar fasciitis is it's inflammation of this fascia that's down here on the bottom of your foot that comes in and attaches here at your heel. And so if you push down there, you're going to find that is generally very tender if you have plantar fasciitis. You might have some other tender spots throughout your foot, but most common is going to be right down here where it attaches. And that happens among runners or other people that might not have the strength or stability in their feet to kind of keep their arches where they should be. So there's a couple things that research has shown that can be very beneficial for plantar fasciitis, especially when you have pain first thing in the morning. What you want to do is get up, and before you stand up, take your foot, bend your toes back, bend your foot back, and then just kind of stretch that out and just kind of work that back and forth for maybe 10 to 15 times. And that's going to help kind of stretch things out and give that a little bit of relief as you stand up. Another thing you can do is get your foot and have something to bring your toes up. And then you're just going to kind of stretch your calf. And so come forward and stretch your calf like that with your toes bent. And then you can also stretch it with your knee bent. And that gets into the soleus muscle. And that all comes down here, attaches and wraps around to where that fascia attaches. And so that takes some additional pressure off of it. One thing I have found in my own practice that works really well for people with plantar fasciitis is taking this massage gun, taking your foot, bending those toes back, and then just working on that plantar fascia all the way up in here and getting that loosened up. And that tends to really help people that have plantar fascia. You want to look and see how much movement you have in your big toe also. With your big toe, you should have pretty good extension there. If your toe doesn't come up as far, that's going to be because you have tightness in that fascia. And so working that muscle with a massage gun or just kind of stretching that out to get that toe back will help give you more movement in there and help you that fascia relax. And then there's a couple exercises I like that I have people do to help strengthen their feet. What you want to do is when you're standing on the floor, get your foot flat, and you want to think of your foot as a kind of a tripod. So you're going to have the bottom of your feet here, and then these two spots, okay? And you're going to want to make sure all three spots are touching evenly, and then you want to push your big toe into the ground, and as you see, my arch kind of lifts up as I do that, and you lift all your other toes. Now you might feel that kind of almost cramp if you've never done this before, and it's going to be hard. A lot of people struggle to get the big toe down and the other toes up, but that helps work that arch and those muscles in the arch. You want to be careful that you don't roll your foot in to do that, okay? You want to keep, again, those 3 points set on the floor. And so push that big toe in and pull and lift the other toes. And then you do the opposite of that. You push the other toes in and lift your big toe up. Again, making sure you don't roll your foot one way or the other, but keeping that flat on the ground as you do that. And so starting to work on those exercises, doing the massage gun, doing those stretches will help you with your plantar fasciitis, give you some relief, and should get you back to where you can do your normal activities. Now, don't wait too long, because the longer you wait, the more difficult it tends to treat. So the quicker you get in and get things taken care of, the quicker you can get out of pain.